I'm one of the MSPs for Central Scotland region. So I'm based in Lanarkshire. My office is in Coatbridge, and I represent people across North Lanarkshire, a big part of South Lanarkshire and all of Falkirk. So it's 3 different local authorities and 2 different health boards. So it helps me to see what's going on, not just in one community, but across a region. I might come back to that point later. I'm a Scottish Labour and Scottish Co-op Party MSP, so I get to be in 2 parties, but that hopefully shows the sort of collaborative nature of the work that I do, and probably led to me in the last Parliament session saying to colleagues, we've got lots of cross-party groups where we bring people together within the Parliament and outside of Parliament on issues that we feel are important and merit a cross-party group. And there were loads that were health related, but nothing that was looking at women's health in particular. And at that time I was running a campaign to end period poverty and to work on legislation for universal free access to period products. So that was a successful campaign, but that sparked a much bigger conversation about women's inequalities, and particularly in relation to health. But as Isabel has said, you know, people don't just sit in a box. So if you're experiencing health inequalities, that affects your income, your participation in the labour market, it affects your family and relationships, it affects your education, it affects every part of your life. So it's really important that we don't just think about lipedema as a health condition, but it's fundamentally about a whole person approach and to make sure that people get the support they need at every age and stage of their life. So I'm very passionate about women's health. I'm still the convener of the cross-party group, and what we've been doing since 2021, since the election in this current Parliament term, is we've tried to, because we can't do everything, but we've tried to align our work to track the women's health strategy. So it's really good that the Scottish Government has a women's health strategy. It's really good that we have a women's health minister, and you're going to, I think, hear from Marie Todd today as well. But I was disappointed to see that lipedema is not in the women's health strategy. I think that's an omission that needs to be fixed. So we now have a women's health champion, Professor Anna Glazier, who I think is going to be an excellent appointment. We have to remember she's not the government, so it's the government that we have to hold to account, and they remain responsible. But having champions for women's health can only be a good thing. And the women's health plan and strategy will obviously be kept under review and it'll be updated. So whilst it does signpost to websites like NHS Inform, which takes you to information about lipedema, I think it's really important because, you know, lipedema is not a rare condition. It's actually really common, as you all know, or more common than people think, and it does predominantly affect women. So it should be in the women's health strategy, and if you're speaking to the Minister, Marie Todd, I think that's an ask that you have to make. Because if you're not in the plan, it's going to be a struggle to get resources and to get investment. And I will admit I did not know about lipedema until 2017. I had never heard the words, I'd never heard about the condition. I wasn't aware of knowing people living with lipedema. And it was a friend of mine who sadly passed away a couple of years ago, but she came to me and said, my daughter has this condition and you need to do something about it, because we've got women having to get into debt, having to borrow money, having to go for private healthcare because they can't get treatment in Scotland. Now, I told you I'm in Lanarkshire, so we don't have a Mr. Alec Munnick in Lanarkshire. So women in my area were saying, what do we do? Where do we get treatment? You know, we know that there's surgery available in Nine Wells, but how do you even get a referral? And, you know, obviously what was happening in Nine Wells wasn't exactly, you know, a panacea either. But these were the challenges, because we do have, you know, in Scotland and in the UK, we do have health inequalities, but we also have a postcode lottery as well, where depending on where you live in the country, your pathway for care and the options available to you could be quite different. So that conversation with Kathy about her daughter Anne, that experience and that story really, sat heavy on me, and I thought, right, this is awful. This is a woman who at that point I think would have been late 40s. This is a journey she's been on since her early teens, and she's been blamed and shamed and made to feel it's her fault for being a certain way or being a certain shape or being a certain size or not doing enough exercise. And when she started to explain to me that the pain that she was in just to get up and down the stairs, the impact at work, the impact on family life. So as a member of the Scottish Parliament, I thought, well, we have to try and do something. So eventually that led to, after lots of questions, it led to an event. So going back to this women's health group, which again, it's important that we have these groups, because if you're not in the room, you're not being heard. And if you're not being heard, when Parliament and government are making decisions about budgets and about workforce plans and about priorities, you're not even on the radar. So that was really important. And what really struck me about that event, because the Women's Health Group were very popular. People want to come and be at our events and want to be guest speakers. But it wasn't just women in Scotland who were saying, I want to come to Parliament. With people flying up from different parts of England as well, because they're saying, lipedema never gets discussed in Parliament. This just doesn't happen. So that really told me that this is an area that has really been neglected in terms of healthcare, and it's poorly understood. So as MSPs, people sometimes don't listen to us, often they don't, but we do have a platform, and that means that when we're out in the constituency or regions and we're doing our surgeries, we have social media. Some of us have TikTok, not me, but there was a video of me dancing on TikTok at the weekend, so I won't be doing that again. But the important thing is we've got different ways that we can reach people, local press, national press, and so on. And it's really important when there is low awareness, particularly of a health condition, that we use our platforms. So I'm getting the signal that there's 1 minute left. So if there is time, what I really would like to do is just stop talking so I can hear from you, take some questions, because a lot has happened. We've had COVID, we're in a cost of living crisis, the NHS and social care, and indeed our public services are on their knees like never before. And I don't claim to understand it. I'm not a clinician, I'm a town planner. But, what gave me hope is that we do have people like Alex Munnick sitting at the back here, who's not just an expert in his field, but is someone who really cares and someone who's been a real advocate for his patients. And I don't claim to understand the decision in terms of the NICE guidelines, but it just doesn't really make sense to me. And I'm really interested to hear what people think about that. Because for me, as Isabel has said, liposuction and surgery, we know that's not for everyone, but we need to have as many options as possible for people. It's something that's obviously had a positive impact in your life, Isabel. When I hear about women coming off waiting lists and having appointments taken away from them, to me that feels like the wrong direction. So today I would say, let's get lipedema recognised, let's get it into the Women's Health Strategy, let's keep working with the Scottish Government to do that. It's great there's been funding for the scoping report, and it's good that government is starting to pay that bit more attention. But I think across Parliament, across government, we need to raise awareness of lipedema. I'd love to see you all at the cross-party group on women's health. We have a Twitter account, it's free to join. Alice from my team is here. If you can't get a word with me, do get in touch. And you don't even need to say anything, but just being there and having that support of other people who understand and who care, I think can make the difference. So if that's okay, I'll stop talking at you, and if you have questions for me, I'll be happy to try and answer them. Thank you.
Thank you very much. We'll hold you to the cross-party meeting.
Absolutely.
Got your diary there?
We probably can tell you when the next meeting is. Alice will know. So yeah, do people have questions?
Yeah. Does anybody have any questions at all?
This is your big chance.
Oh, there's Ali
It's always me, isn't it?
with the beautiful purple hair.
So what can each one of us do today that will help get it into the women's strategy? Because if that's one of the key issues that we've got, how do we force that?
So a few things. If you haven't done so already, email your MSP or MSPs. So yeah, so you've got, I can say, oh well, I'll give you my pledge now. So we've got constituency MSPs and regional MSPs, so just email everybody. What you could also do as well is just send a cheeky wee email to the 3 candidates who are vying to be the next First Minister. I've been doing that a lot. It's amazing what people say in a contest like that. So exploit every opportunity that you can. But right now we do have a Women's Health Minister. I'm not sure if Marie's here in person today or you're getting a video. So I would definitely say, being at this conference today, it was great. But we really need to have Lipoedema in the Women's Health Plan. She might not be the Minister in 2 weeks' time because there's probably going to be a reshuffle. But if she is, or maybe she'll get a promotion to Health Secretary, I don't know. But don't be shy. Please, please, please use your voice. And as MSPs, we had a team away day yesterday talking about what comes through the inbox, the priorities. When you start to see emails coming in, and not just you, somebody as a patient, but your family, get other people to email as well. So I think that really helps. And Professor Anna Glazier, who's the Women's Health Champion, she's new in the role, and I'm sure she's really keen to listen and engage. And another option that you might want to think about collectively is it's underused in the Parliament, but you can lodge a public petition on pretty much anything that's within the Parliament's remit, and that's a really good way to influence policy and decision making. So if you look on the Parliament website, I think it's now called the Citizen Participation in Public Petitions Committee. I go all the time with constituents because it's a really good way to get attention for issues. So another wee option.
Yep, we've got another one next.
Can I just ask? I used to be involved in the endometriosis services within NHS Lothian, and there was a huge drive towards making endometriosis centres, one within each health district, and all these patients came together and were looked after by experts, and there was a whole team, so it was very multidisciplinary. Can you see that as a way forward for lipedema patients?
We want it to be the way forward.
So I think we can learn from what's happened with other conditions. So I'm actually hosting an event in Parliament tonight for Endometriosis UK. I did say I'm very passionate about women's health, so it's Endo Awareness Month. So I would say awareness around endometriosis, we can always do more, but it is a condition, I think, that has been getting a lot of parliamentary time and media coverage. So I think that shows that campaigning works. In terms of the treatment centres, I think that is the right approach. Again, in terms of lipedema, I think the people who know best are the people who live with lipedema and working with your healthcare teams. So if that's an ask that you have, then let's refine that and develop that. But my experience in politics, I've been in the Parliament since 2016. If you don't ask, you don't get. And sometimes people come in and say, "Oh, I'll just go in and ask for something quite low," because no, don't do that, because they'll always negotiate down. So aim high. If that's what you want collectively, then work up a plan and go for it.
Just to, because I have the right person here, I also have stage 4 endometriosis as well as lipedema. I've been going to both clinics, both in Edinburgh and Glasgow. The Glasgow clinic, I was supposed to have an appointment in March, and I got a letter in the mail a couple of weeks ago saying your appointment has been delayed until August. So just to let you know that, you have great ambitions for lipedema, but I think even the existing services still need a lot more attention, which I'm sure you're aware of.
Yeah, no, 100%, and thank you for sharing that. I'm sorry about the delay.
It's not your fault.
No, but it's, we're not here just to say, oh, that's the government's fault. At the end of the day, in Parliament, we all have to speak out and take some responsibility. So in terms of the casework I receive, obviously across the board in health, it's about delays. But I think about a constituent of mine in Lanarkshire who's living with endometriosis, and right now, and she's feeling really ashamed and embarrassed about what she's going through, and there's big concerns about impact on her fertility, so it's putting a strain on relationships and family life, and being off work sick and losing pay and all of that. So it's really, really distressing. I think I'll bring it back to the workforce. So working with yourselves, back in the last Parliament when Jean Freeman was the Health Secretary, and every year government does programme for government, and that sets out priorities. So we lobbied government to get a women's health plan. They called it a strategy, that's fine. But what we really wanted was to have a plan or strategy that was properly funded. And that's because we need to invest in the workforce. So on endometriosis, like lipedema, really hard to get a diagnosis, to get a correct diagnosis. So with endometriosis, right now on average, it takes about 8.5 years to get diagnosed. It can be longer. Government have said we're going to bring that right down to 12 months, which sounds amazing, by the end of 2026. But unless there's the resources to properly make that happen, and that has to be by having, you know, the right teams in the right parts of the country. So I think everything does come back to workforce planning. I think I'm never going to criticise the government for being ambitious and having these important pledges, because it gives us all something to work towards. But what would be really unforgivable is if, you know, we fail to deliver on these promises. So for me, it's about how do we bring that strategy to life? How do we see progress? So going back to the cross-party group, the reason why we have a work programme is we're trying to take out key themes from the strategy, and whether it's the minister or other officials from government or Anna Glazier coming in, just constantly getting some progress updates on that. And that's why you'll find that if you go onto the Parliament website, MSPs can write in with written questions, ask hundreds of questions, and it's a good way to hold them to account on that.
That's brilliant. Thank you. I think there was. Can we get you? Do you want? We've got a question and answer later on. Do you want to pop that down on a bit of?
What I can do, I can hang about during coffee. I know you want to hear from other people, but thank you for the questions. Thank you so much.
We've got a really tight programme, so we've
Great.
got to move on. So
Great.
thank you very much.
I'll wait for
Monica.
questions. Yeah,
That's
thank
been
you.
brilliant.